Natalie Ray here with Regen and Aesthetics Concierge of Texas, here to give a little bit more information about our Ketamine Infusion program and just the overall background of ketamine for mental health in a PowerPoint format. So, in overview, ketamine therapy is really a revolutionary approach enacted in the last 10 years to treating psychiatric disorders and chronic pain resistant to conventional treatments. Ketamine is effective in 70 to 85% of cases of major depression, PTSD, and anxiety, really offering new hope for patients not helped by traditional medications. These numbers are really pretty astounding when you compare them to conventional treatments, and really, really encouraging for those of us in the mental health realm. We do have robust clinical evidence that demonstrates both rapid and long-lasting relief for mental health systems. So now, 10 years after its advent of use in the mental health realm, we have massive clinical studies demonstrating efficacy and safety of ketamine's application in mental health. So some highlights: ketamine is derived from phenylcyclidine, which is primarily acting as an NMDA receptor antagonist. So we are alternating glutamate signaling in the brain through ketamine. So IV ketamine therapy distinguishes itself from other mental health treatments, such as oral medications, nasal sprays, etc., because through the IV approach, we have swift brain access and short half-life, resulting in rapid effects and minimal side effects. The mechanism of ketamine comes down to its enhancement of BDNF production. It's a pretty complicated pathway involving AMPA receptors, mTOR, tryptophan kinase B, etc. But the root causality of the growth of healthy neurons is through the cell signaling, which creates BDNF, which then grows healthy neuronal connections and structures. So BDNF is key in terms of how ketamine works in the brain. So a little background on the clinical adoption and current status of ketamine in clinical use. Ketamine has been used for many, many years in anesthesia, but it transitioned about 10 years ago to a major use of ketamine being in the psychiatric realm. Its use in mental health remains largely off-label, but it is a practical move to address the critical need for new treatments that are effective and rapid acting in the mental health world. There is massively growing medical acceptance, even without specific FDA approval for psychiatric uses, due to all the clinical data demonstrating safety and efficacy. So ketamine really has become standard of care in mental health. Let's see, next slide here. The mechanisms in neuropsychiatric treatment. So we kind of touched on this before through the activation of BDNF. Ketamine impacts various brain pathways, leading to its effectiveness in treating multiple neuropsychiatric conditions. Those include chronic pain, depression, PTSD, anxiety, obsessive compulsive disorders. I'm probably leaving out a few, but really across the board in mental health and pain has shown a lot of clinical evidence of effectiveness. And we touched on that ketamine boosts glutamate activity and through multiple cell signaling pathways activates BDNF, which repairs neural pathways in key mood regulating areas like the prefrontal cortex and hippocampus. And then I would also roll that over to also pain pathways. It can modulate those as well through that activation of BDNF. Implementation and care with ketamine. So patient selection and monitoring is very crucial. Our clients are to be candid, are carefully chosen based on their psychiatric and medical evaluation to minimize risk. The infusion process at the clinic is very closely monitored. We have a nurse one-on-one monitoring our patients during ketamine infusions, tracking vital signs and patient feedback to adjust treatment as needed. So because ketamine is through an infusion, it does require one-on-one monitoring. Very, very important there. Supportive treatments, including psychotherapy and lifestyle changes, are essential to maintain the benefits of ketamine therapy. So kind of outside the scope of this presentation, in other presentations, I will address really the comprehensive approach we take towards mental health, which is very, very important for ketamine's effectiveness and durability, that a comprehensive approach is taken, and that is our approach at R&ACT. In terms of research and direction in ketamine's future, so its current success is driving more and more research into its use for other neurodegenerative diseases and neuroinflammation, and potentially emergency suicide prevention. It is currently being used in many emergency rooms across the country for that exact treatment. So a lot of studies going on, exploring new ways to administer ketamine and create some drugs similar to improve benefits and reduce side effects. This is a very exciting growing area of research in the medical field, in the mental health field. So one key thing to understand is because ketamine is generic, there are no big pharma companies that are likely to back and financially benefit from the process that is a typically multi-billion-dollar process to get FDA approval. So it's unlikely it will obtain FDA approval for mental health, but it is considered standard of care due to the clinical evidence behind it. So next slide here. Couple different types of ketamine therapy that is applied to mental health: IV infusions and nasal sprays. IV infusions are really the gold standard due to precision of duration, the bioavailability being 100%, the ability to titrate, and the vast majority of clinical trials have been done with IV ketamine that have demonstrated the improvement in mental health and pain. The con with IV ketamine, it is not approved by insurance, so it may be cost prohibitive for some, and generally requires an on-site anesthesia provider. The nasal spray, the pro is that it may be approved by insurance. The con is the clinical evidence shows less reliable improvement in symptoms. So at Regen, we only offer the ketamine IV infusion for mental health due to it being the gold standard. Some benefits and considerations. Huge benefit for mental health and pain is the quick and notable improvement. One thing to think about, there is a low but present addiction risk. One thing I think I failed to mention before is that ketamine, we have a lot of clinical evidence behind ketamine's efficacy in treating addictions, but it itself, though very low, does have a present addiction risk. It is not effective for about 20% of patients based on clinical studies. I will tell you, due to the comprehensive approach we take and some of the adjuncts we use with ketamine, we have higher effectiveness rates than many of the clinical studies. Booster sessions may be required for lasting benefits. And as we've touched on, it needs to be kind of a comprehensive approach to have the best effectiveness. Contraindications to ketamine infusions include certain heart conditions, elevated eye pressure, pregnancy, liver disease, and acute porphyria. And it is essential to administer ketamine under professional medical supervision for safety with the presence of one-on-one monitoring and an anesthesia provider. Preparing for ketamine therapy, some things to think about: avoid benzos, alcohol, and cannabis for 3 days before the treatment to improve brain response. This is really, really important if you are considering getting a ketamine infusion. The benzos, alcohol, and cannabis are going to block the receptors that we need access to through ketamine to enact the BDNF pathway. So extraordinarily important that our clients stay away for 3 days from benzos, alcohol, and cannabis. Even longer would be better. Clients can continue essential medications like blood pressure medications, but we advise skipping antidepressants and anxiety meds on the day of infusion. We do ask our clients to fast for 8 hours before the appointment, and we go into all this information during our education, pre-ketamine education session, but clients can drink clear liquids up to 2 hours before the infusion, and clients must arrange a ride home after treatment for obvious reasons, for safety. You can't drive after getting ketamine infusion. What to expect during a treatment. So our treatment occurs in a quiet, comfortable setting. We do provide music. The music choice is really, really clinically proven to be important. The hertz, the bandwidth, etc. So we have curated options for music for our clients, and they can choose between those options. And music has really been shown to be a good adjunct in terms of optimizing the ketamine journey. Patients will often feel detached from their body, a sense of well-being, and increased connectedness, along with a fresh outlook on life. Temporary nausea and dizziness is possible, so this is why we encourage clients to fast, and we do administer anti-anxiety medication before treatment to help manage these symptoms. The initial course of ketamine involves 6 infusions over 3 weeks, with each session lasting about 15 minutes, followed by a 30-minute observation period. And during that 30 minutes, we do provide a post-infusion antioxidant infusion, which is really going to help maintain the results of ketamine. And combining ketamine with therapy enhances treatment by leveraging a state of heightened brain adaptability to foster positive changes. So during this time of optimal brain neuroplasticity, it's really important to engage in other mental health therapy so that you can really optimize the long-term effects of ketamine. In terms of cost and how to get started with our program for ketamine, we do require either a transfer of medical records or referral from a healthcare provider. An initial series of 6 infusions cost $3,000. Maintenance doses are priced separately. So the initial infusion of 6, the initial series of 6 is the gold standard. And then after that, booster doses may be needed anywhere from 2 to 8 months apart. And we do provide additional modalities to really enhance the long-term effects of ketamine that we go into options for that during the consultation. In terms of future implications and impact, ketamine, just to summarize, really represents a breakthrough for those conditions unresponsive to standard treatment. And continued research and clinical integration have the potential to really revolutionize mental health care. At Regen and Aesthetics Concierge of Texas, we offer medically supervised IV ketamine infusions. Our patients are monitored one-on-one by an experienced nurse, and an anesthesia provider is on site at all times in a supervisory role. Our mission at Regen and Aesthetics Concierge of Texas, we are very, very passionate about the journey, this treatment, and the way it's really able to transform our clients' lives. And our mission is to care deeply, encourage greatly, and deliver exceptional results. We provide premier concierge care, regenerating the face, mind, and body. Please feel free to reach out to us if you have any questions about our ketamine program.